things were not talked about a lot back in the 70s and 80s. So that was one eye-opener. So getting back to this last slide, this resulted in watered-down training programs that simply mimicked those of the fitness professional and were not specifically designed to meet the client's goals, needs, and abilities. And these last three slides were excerpts from the National Academy of Sports Medicine OPT for the fitness professional. And that OPT basically stands for Optimal Performance Training. And it's a great system. I recommend anyone that's actually trying to become a personal trainer to actually, I encourage taking the NASM course. It's basically nasm.org. You can find out more information about it. So that was then. The new model that I try to adapt to, and I think a lot of seasoned professionals, certified personal trainers, especially from NASM, are adapting to, is this new model, which basically, I'll read off the slide, training an individual, particularly a beginner, should be systematic and take into consideration the following factors: a comprehensive assessment. Now, in the past, we've done assessments at gyms that I've worked at, actually at medical facilities, that we were mostly concerned with blood pressure, resting heart rate, and maybe possibly doing a stamina test to test cardiovascular. But nothing was really done on an orthopedic standpoint, like posture, as you see on the slide here. A comprehensive medical history to find out what types of medications they're on. So the thing that happened, like I said earlier, won't happen. If somebody's on a beta blocker, we know that we can't use their heart rate as an indicator of how hard they're working. The postural assessment I'm going to explain and show in a little bit, actually live, so you can see what it's like. And then goal setting, what a person's looking to do. Sometimes you have to really pull it out of them, because a lot of times people say they just want to get in shape. Well, getting in shape really doesn't mean a lot. It means a lot of things to different people, so I have to tease out what that actually means to each individual. And then on the box on the right, a strength and conditioning program that emphasizes stabilization of the core musculature, which we'll explain, proprioception, which is basically knowing where you are in space. It's balance, another way of saying balance to some extent, and correcting any muscle imbalances, which we'll discuss further on the show. Okay, as promised, we are going to do a postural analysis. We want to do the whole thing. Unfortunately, because of lack of time, we're going to just do from the hip to the foot. And we'll get a lot of things accomplished, believe me, from just the hip to the foot, especially at the feet. David is our model here. He was nice enough to come and show off his feet. We're going to pan in on his feet. We're going to show David's feet. This is the first thing I look at during a posture assessment. I look at the patient or the client's feet, and you can see how they're extremely flat-footed. And I just want to go over the three different foot types while she's keeping panned in on the feet. There's flat feet like David, which is what we call in this industry pes planus. And then we have also a high arched foot, which David is definitely the antithesis of that. And that's usually called pes cavus. And then we have a neutral foot, which is in the middle of both of those extremes. It's a pleasure, believe me, to work with a person that has a neutral foot. Okay, so getting back to David's feet, we see obviously they're flat. What I'd also want to do is I'd also want to check out his walking mechanics, what we call in this industry a gait analysis, and watch his walk, which we're going to go over. And I want to see if I see any abnormalities. Usually people that have flat feet, not all the time, but usually we see them overpronate. And I'm going to explain that when I go over the phases of the walk cycle or the gait cycle. Okay, let's talk about the phases of the walk or gait cycle. It starts when the foot hits the ground. We call that initial contact. Normally, we should strike on the lateral side of the foot, which David was doing, incidentally, when we reviewed his gait. This is called supination. Normally the lateral or outside of the back of the sneaker is worn due to this phase, which is perfectly normal. Now the second phase is when the foot actually hits the ground. This is called loading response, which is usually when our entire foot touches the ground. The main purpose is to adapt to the terrain, which is also referred to as pronation. Pronation is an absolutely necessary component of the walk or gait cycle. Pronation allows for shock absorption. If you don't pronate, it's like having a car without shocks. During pronation, the inside portion of the foot, as my camera person is going to pan in on, the inside portion of the foot rolls inward or really flattens out, which again is for shock absorption. David passes the loading response, or the second phase of gait, with flying colors. The problem is, you'll see in a second, the third phase of gait is when the body